Everybody ready? 4 years ago, Kentucky was shocked to discover that overdoses of prescription painkillers and other drugs were killing more of us than car wrecks were. Now, we all knew that drug addiction had been a big problem for decades, but many Kentuckians had grown numb to the devastation that it caused. But realizing that our medicine cabinets in our bathrooms were more dangerous than our highways got people's attention. The result was House Bill 1 and a companion cleanup bill passed a year later. Together, they declared our intent to bring integrity to the use of prescription painkillers and to end the scourge of abuse and misuse that was destroying our people. Today, I'm here to report for the third time on the impact of those efforts. And I have good news. Simply put, a year-long report by independent researchers shows that House Bill 1 is working. Now notice I said working and not worked, because the fight against drug addiction is a never-ending process. The increase in overdose deaths between 2013 shows the pervasive and cyclical nature of addiction. But as the numbers from today's report show, House Bill 1 is succeeding in creating a paradigm shift in the behaviors and attitudes of prescribers and patients, a shift that will pay off long term. In this new environment, the decision to prescribe a painkiller has become more of a conscious, measured decision between a prescriber and a patient, with the dangers of addiction well known and accounted for. Furthermore, most of those who were involved in this process out of greed and other reasons, such as certain pain clinics and other middlemen, have been driven out of the Commonwealth of Kentucky. Now let's talk about some of the details. The analysis was conducted by the University of Kentucky Institute for Pharmaceutical Outcomes and Policy and sent to the State Cabinet for Health and Family Services. Researchers looked at House Bill 1, which, as we all know, made an array of changes involving a mix of enforcement, oversight, education, and treatment. It was a complex bill for a complex problem. We knew we had to educate well-meaning doctors and patients alike, many of whom seemed unaware of the dangerous and addictive nature of these medications. We needed to crack down on reckless prescribing by a handful of rogue doctors, the so-called pill pushers in white coats, who were motivated by greed and not patient care. We needed to drive out their like-minded colleagues at those pain clinics run like profit centers and not care centers. We needed to improve collaboration and communication with other states. And we needed to expand substance abuse treatment for patients whose need to combat pain had led them into a trap of addiction. All the while, we had to make sure we didn't interfere with those patients suffering chronic pain who genuinely needed this medication to create and maintain a tolerable quality of life. Those were ambitious goals, but according to this study, we're meeting those goals. Since House Bill 1 was implemented, 24 non-physician-owned pain management facilities have ceased operation in the Commonwealth. The number of prescribers using Casper, the statewide monitoring system set up to combat doctor shopping and drug diversion, increased from 7,500 prescribers using it to 27,000 prescribers using it. The number of queries has increased from 800,000 a year to almost 5 million queries a year. And as a result, the number of patients identified as doctor shoppers decreased by 52%. The number of prescriptions written for the most abused and dangerous prescription painkillers has declined significantly. At the same time, the number of prescriptions for medication-assisted treatment increased by over 40%. Finally, law enforcement and licensure officials are acting more aggressively to weed out bad actors. From July 2012 to March 2015, the Kentucky Board of Medical Licensure has taken 196 disciplinary actions against 142 physicians related to prescribing practices. In short, more doctors and patients are acting with caution to help patients with legitimate pain relief, and those who were acting recklessly or out of greed have been largely driven out. Now, I know some members of the healthcare community were concerned when we passed House Bill 1 that it would interfere with legitimate treatment of pain. But this report showed that the vast majority of providers now report no negative impact on their professional practices. Now, are we declaring victory? Absolutely not. The problem of drug addiction is stubborn. It's ever evolving, and it requires nothing less than full engagement by every aspect of society. This report on House Bill 1 shows that it has been an effective tool in the fight against prescription drug abuse and misuse. We just passed Senate Bill 192 in the recent session. It is to address the growing epidemic of heroin, and that will give us more tools. And Medicaid Expansion has helped us on the treatment end, and that has expanded by 300 the number of new behavioral health providers that people will have access to. As a result, at least 13,000 Medicaid members have received treatment for a substance abuse disorder since January of 2014. Kentucky's come a long way in the fight against drug addiction, and many people and many organizations have been key players. With me are many of them, officials who have helped me to lead this charge. They include, first and foremost, the First Lady of the Commonwealth, Jane Beshear. It also includes Lieutenant Governor Crit Llewellyn, Attorney General Jack Conway, Senate President Robert Stivers, House Speaker Greg Stumbo, Van Ingram, head of Kentucky's Office of Drug Control Policy, and the secretaries of the two cabinets involved in this effort, Audrey Tays Haynes of Health and Family Services and J. Michael Brown of Justice and Public Safety. These leaders feel very strongly about this issue, and we have worked together aggressively to attack it. Also, a large number of legislators, some of whom are here today, have been key advocates, members of the Licensure Board, the Inspector General's Office, the Cabinet, and many others involved in this fight. I also want to thank this team from the University of Kentucky Institute for Pharmaceutical Outcomes and Policy for doing this study. But most of all, I want to thank the broader healthcare community, including not only prescribers and pharmacists, but substance abuse counselors and many others. We all know this issue is about people, helping good people who, because of pain and other disease, have been led down a very dark path. They need our help. And you on the front lines who are providing are helping to save the future of this state. Next, I'd like to ask Attorney General Jack Conway to come up. Jack.
Thank you. Thank you very much. Well, Governor Beshear, thank you for that kind introduction. Good afternoon to everyone gathered here today. And I'm certainly proud to be here for the second anniversary of House Bill 1. It really was a landmark piece of legislation that became a national model. Governor Beshear mentioned it essentially did three things. It required doctors to CASPR before prescribing controlled substances. It requires doctors to make ones that are actually operating and owning pain clinics. And it provided those of us in law enforcement with increased access to data. Let me take you to where we were just a few years ago before this law was passed. we had 48 pain clinics in this state. Many were being operated by those who decided that they would try to profit off of people's pain and addiction. They were, for all intents and purposes, drug pushers, employing people in white coats to write the prescriptions. People were lined up around the block at these clinics. They were clutching fake MRIs in one hand and cash in the other. Many times the doctors that were, they'd lost their licenses in other states, Van. Since House Bill 1's passage, we've shuttered just about every one of this state's non-compliant clinics. And as a result, opiate prescriptions are down and usage is down, according to the most recent data that we've compiled. And today, our State Board of Medical Licensure is working with law enforcement to help crack down on overprescribing physicians. To date, law enforcement has received 211 cases referred by the Kentucky Board of Medical Licensure since the passage of House Bill. And you know what? We're not hounding doctors. And for all those rumors that where physicians thought the Attorney General to be up late at night looking at the prescribing habits, that hasn't happened. But what has happened is a culture shift amongst the Board of Medical Licensure. In my first term as Attorney General, we received zero referrals from the Board of Medical Licensure. Now, we are working with them to make certain that we ferret out the worst actors. I want to thank Governor Beshear. I want to thank Senator Stivers. I want to thank Jimmy Higdon. I want to thank Speaker Stumbo. Each one of us up here has something in common, and that's that we care more about this state than we care about politics. And House Bill 1 happen when we put politics aside and focus on people. After the passage of House Bill 1, we did indeed see an uptick in heroin usage. You know, that makes sense. Heroin is an opiate, and right now it's cheaper to get on the streets. But once again, this past session, we came together to draft legislation to address that surge. And that legislation is now making a difference. We now have Narcan in the hands of our first responders and in hospitals. We've increased penalties for traffickers. We gave communities the option of changes if they so choose. And we increased access to drug treatment. And that focus on treatment is something that we must continue to address. I'm proud of the $32 million from settlements with pharmaceutical companies that our office secured that actually went to expand drug treatment throughout the state. The court ordered that the money be used this way, and the money is now making a difference in our communities. It's been a real honor to work with the First Lady, Jane Beshear, on this initiative. And together, we've done some very good work. We've created options for juveniles. We've completed the construction of a Recovery Kentucky Center near Ashland. We've provided scholarships to the other Recovery Kentucky centers. We've built and funded halfway houses for addicts treatment. And we've kept open 2 treatment centers that focus on addicted pregnant women. But folks, we must do more. We can't arrest our way out of this problem. There aren't enough courtrooms and there aren't enough jail cells. But I know that we can do more, and we're working together. We will continue to address this problem just as we've done before. Governor, thank you for inviting me here today.
Next, let me call upon President Robert Stivers.
Thank you, Governor, and the individuals that are here. I really can't add any more as to what's been said by the Governor and General Conway. You know, we have seen this, and I will make one comment because I know that personally I received a lot of criticism about this bill, both the first time it went through, Mr. Speaker, and the second time when we came and did some revisions. But I think it was borne out by something General Conway said. When you saw the reduced access to prescription drugs, then you saw the balloon pop out in another area, and that was with heroin. And I think it proved a lot of the naysayers about this legislation wrong, about the need for it. And we have shown, and another discussion that I've had with the Speaker, that the Board of Medical Licensure, with the Governor, is slight encouragement, has has actually started to do some policing many years ago. I think it was the Speaker and then Senator Dick Roding who started this process, and very few referrals came from the Board of Medical Licensure as it related to prescription drug abuse. But I think the final thought I would leave with what we've seen over the last several years with pseudoephedrine, methamphetamine, going to House Bill 1 and prescription drugs, now to this session with the Senate bill on heroin, that we understand as policymakers. There's times that we have to look, because when somebody's out there dealing in a drug, you know, Ronnie, they don't ask you if you're a Republican or Democrat before they sell it to you. They just want to try to profiteer off the system, and they don't care about the heartache and pain they create for families. And we, as the policymakers here in Frankfort, know when it's time to come together and work on issues, and we have done so over the past several years. And I think that's a credit to everyone here involved and everyone out here today that was involved, that we were able to see the problems and try to take substantial steps in solving those problems for the betterment of Kentucky. Governor, I appreciate it and appreciate your leadership on this issue.
Thank you. As Senator Stivers pointed out, this is an issue that doesn't discriminate on the basis of politics or in any other way. And our legislature stepped up, both Republicans and Democrats, and came together with me and many others to work on this issue. And we've had considerable success with House Bill 1. We're hoping for the same kind of success in the heroin area with Senate Bill 192. We already know there are other things on the horizon. Now looking at synthetic drugs that are surfacing. So this is a never-ending process. But that doesn't mean that you don't attack the problems as they arise and try to save and rehabilitate as many of our citizens that get involved in this as is humanly possible. And one of the other players that was absolutely vital to this role was Speaker Greg Stumbo. Speaker.
Thank you, Governor. Thank you, Governor. And I think everyone's already said about all that we can say on House Bill 1 success. It has become a national model. We get a number of calls from different states. But in my tenure, General Conway, as Attorney General, I came before the legislature twice. And with Senator Stivers' help, as the chairman of the Judiciary Committee in the Senate, we were given two pieces of anti-drug legislation dealing most primarily with prescription drugs that were internet into Kentucky. The point is, the battlefield does change in this never-ending war on drugs, and we should always be mindful of that, and I believe that we will, because just as the speakers have said before me, Democrats, independents, people in the north, the south, the east, and the west, if your family hasn't been touched by this problem, then I would suggest to you that you go home tonight and you get down on your knees and you thank your Lord for that, because just about every family that I know in Kentucky, including mine, has a scourge of drug abuse. We'll continue to fight these battles. Unfortunately, Van, there's no real easy answer, but we'll continue to fight the battles as they appear on the changing battlefields across the state with this terrible, terrible, terrible epidemic. And I will say one final thing, General Conway, and I appreciate you touching on this. It's estimated in Kentucky that we may have as many as 500,000 of our fellow Kentuckians addicted to some form of drugs. It's estimated that maybe half of those would benefit from treatment. We have less than 2,500 treatment beds in this state right now. Van Ingram and I served at the pleasure of then Governor Fletcher on the task force that was created during his administration to deal with this problem. And one of the recommendations was a funding source for the centers of treatment that was dedicated and was continuing, that would reoccur, Secretary Brown, year after year after year, so that we could, in fact, establish more of these places where people can get treatment and help. As most of you know, the Affordable Health Care Act provides a new funding source for people who are addicted and who have drug-related problems. That's a step in the right direction, but I'm hopeful that in the future, Kentucky will step up to the plate, provide some funds that are reoccurring, and dedicate those funds to the expansion of treatment facilities. Because just as General Conway said, we learned long ago we cannot We cannot criminally convict ourselves out of this process, this problem. We've got treatment and education have to go hand in hand with enforcement. We know how to put people in jail, but that's not going to solve the problem, not until we have adequate education and adequate treatment. So, Governor, thank you for your leadership on this issue.
We have Van Ingram with us. We've got the UK folks that did the study, as well as representatives of a number of groups that have worked on this. So does anyone have questions on this topic that we can address?
Governor, on the number of deaths, you said there were many before this. Do you have any figures on how many deaths there were before this law and how many drug overdose deaths we have in 2013? I read in the release it increased in 2014.
Let me ask Van.
Any
Come on
figures
up,
the
Van.
deaths?
Come on up.
Van.
Yeah, in 2012, Jack, we had just a little over 1,000 deaths. In 2013, that dropped to about 963, so we were pretty encouraged. And then heroin's come along, and that's also drove up our numbers. 30% of our deaths involve heroin now. So we upticked to about 1,087 this year. That's Kentucky residents, no matter where they died, because some of them, are like in northern Kentucky, might actually die in Cincinnati. So that's Kentucky residents and any non-residents that died in Kentucky. 1,087 in 2014. But we're hopeful with the Narcan that was mentioned earlier in Senate Bill 192 and the Good Samaritan provision that was also included in that bill, that those things will help us kick in and help us bring.
You know, it was interesting. I was at a National Governors Association summer meeting over this last week. I had a panel that I chaired on substance abuse. And one of the panelists was a lieutenant on the police department in Quincy, Massachusetts. And I believe, Van, that police department was the first police department to have Narcan available to it to help with overdoses. And he had a number of figures that were very encouraging from their local experience about the life-saving abilities that Narcan has and the number of people that they have been able to bring out of the overdose situation, and many of whom get into treatment programs. So I was very encouraged from hearing his testimony that we'll have a similar.
How has the bill impacted the state's jail and prison inmate populations?
Didn't?
It probably figures more into that than.
Well, House Bill 463 was a landmark piece of legislation basically aimed at revising Kentucky's drug statutes, Section 218A. Our prison population right now is well below what the Pew Foundation had projected it to be back in 2008, Governor, when we first, the Pew would have had us up at around, or a little bit north of 25,000 by now. We're, as of today, I didn't look this morning, but we're somewhere a little bit north of 21,000. But within that 21,000, what we've seen is a shift in the category of our population. And in fact, we have just now gone through some issues where we've repurposed some of our institutions so that these individuals who are now coming into the system on Class Ds and low Class Cs, as opposed to the more serious crimes, are being redistributed. So we see population is still up, but the class of the population is down. Now our efforts are going to be aimed at, particularly in some of the provisions in 192 and following up on 463, in dealing with the issue of recidivism. And as these tools, more treatment, we can cut recidivism, we can break that cycle so we're coming back in. That's our main drive right now.
Any other questions on this?
Van, of the 1,000 deaths in 2012, how many of those were attributable to prescription pill abuse compared to the deaths this year?
I don't have the numbers, but it's an overwhelming majority. But what we see in these deaths all the time, we rarely see just one drug. What we see an opiate, we'll see a benzodiazepine, we'll see cannabis, of these drugs that cause the death. But the overwhelming majority of them, even still, have opioids in their system, prescription opioids.
What are the specific date ranges of the study? Was that 2013 until now, or?
Our study was conducted between 2009 and 2013, so we have several years prior to implementation of House Bill 1 and then one full year following implementation of House Bill 1. So we have no data in our study from 2014.
With the overwhelming majority of the deaths are still from prescription opioids, does that mean there's still something that needs to be done here?
Well, a big part of the problem we're seeing now is people traveling out of state again to get opioids they're bringing back. And there's always more work to do. You know, we still have more education to do with prescribers and patients about the dangers of these drugs.
What about funding for treatment? I know that there's a funding mechanism in the heroin bill to help with addiction counseling and rehabilitation services as far as the correction side and then outside. Are there any big moves or funding moves for that now that we're seeing that implemented? I mean, I think the speaker said 2,500 beds, 500,000 people.
Well, as the Attorney General elaborated on, he and the First Lady worked to allocate, how much was it?
$32 million.
$32 million out throughout the state on different treatment programs, building a new Recovery Kentucky Center and providing beds, many for folks with addiction, because we were woefully short in adolescent treatment beds. So that effort is ongoing. Senate Bill 192 allocated $10 million that Secretary Brown, with the legislature and with our office, to allocate now for various types of treatment and education. So it is an ongoing process.
Mr. President, the governor made reference to the Medicaid expansion and how it's useful in treatment. What's your view of your party's nominee for governor's position about abolishing the Medicaid expansion immediately if he is elected?
First, Al, let me say this. I don't think this press conference is really about gubernatorial politics or party politics. Well, I haven't heard the governor conclude yet. But
Yeah, let's keep, if it's okay with you, Mr. President, let's keep this on the topic, and then any otherwise political questions.
At another point in time.
Yeah, we can find, you all can go at these folks individually.
Can I add to that response about?
Yeah.
The task force that Van and I originally got to know each other from, Governor Fletcher's task force, recommended a 3-cent increase in the sale tobacco tax. And 1 cent was to go to enforcement, 1 to education, and 1 to treatment. And if my memory serves, it was about $100 million for each penny. So that was really the first public statement about a dedicated funding source. Obviously, that hasn't happened yet, but I think people are becoming more aware that despite efforts of doing, we still need a continuing funding source that's there every year, that's dedicated for fighting this problem.
Would you back that in 2016?
I wouldn't have. My counties of the deaths that were reported in 2014, Jack, Floyd and Pike suffered first and second. So, yeah, without any question, I would personally.
Anybody else have a question? Okay, thanks very much.